Hello and Happy New Year. Welcome to Global Healthcast, brought to you by Global Health Press. Once a week, we cover for you news on infectious diseases, vaccines, and vaccination. Today is Tuesday, January 3rd, 2023. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt, and Happy New Year. Happy New Year, everyone.
Today is our 24th Global Healthcast edition, and we talk mainly about COVID-19. But first of all, Happy New Year from Melvin. Thanks for bringing this up again. I would not have remembered it, right? I'm still with 2022. But anyway, these are our topics today. COVID-19 update, XBB 1.5 variant, what's happening in Japan, China. We have a study on a medication against COVID, and then we will discuss a bit where we are with COVID-19 today. I think this is a nice start into the year. What will happen with COVID in the future? What happened in the past? What are lessons learned? COVID, Melvin, why don't you start with a COVID update?
Yes, so for those who have been watching our past global health casts, you already know that we always start with a quick update on epidemiology, and we get this from the WHO COVID situation report. This is not real time, and this is actually 2 weeks late. People at the WHO and the national health agencies took a break over the holidays, just like all of us, right? And everyone deserved a break. So this is 2 weeks late, remember that? Globally, the number of new weekly cases reported was similar to the previous week, and the number of weekly deaths was 6% lower than the previous week. So I think what it's trying to tell us is that even with all these different things you hear from the news that the cases are going up again and going up here and there, in general, globally, the cases are actually the same as the previous weeks.
Interesting. Yeah. So, how about the cases per million in different countries?
So this is showing us daily confirmed cases in selected countries and region, namely the US. We have EU here, Canada, China, India, and the UK. And I wanted to point out that in this particular graph, this is from Our World in Data, China reported no data for this given period. And as you can see, the cases are not as high as the end of 2021 and the beginning of 2022 with the start of the Omicron variant. And I think, again, it goes back to what I said in the previous slide, that even with all these different doom and gloom news that we hear on mainstream media, the situation is not as bad as in 2020 and 2021.
Do you think that there is really no case in China? I mean, this is December 31, 2022, right? And there were almost zero cases in China here. I guess there's a little blip here, and then it's again down to zero. They stopped their corona measures mid-December, if I remember correctly, 12/12 last year. So is this trustworthy data, or is this lack of reporting, or Christmas delay, or what is this?
This is just not reporting from China. And I think, again, this doesn't give the world confidence about the data coming from them, right? So, yeah.
What can we do?
Yeah.
Yeah, what can we do? So we don't know, we can only know what we see, and the interpretation is always with the political situation in mind, right? So I guess it is quite correct from countries where healthcare systems are not run by the government, or where there are open societies, but from China, we simply don't know what's going on.
Yep.
Yeah. This is deaths.
Yeah, so if you look at the same countries and regions, but now focusing on deaths and not cases, the number of deaths were really much higher at the beginning of the pandemic. That's 2020, and with a Delta wave. So bear in mind that this is just showing some countries and region, but then again, it gives you an idea that we are really in a much better situation now as compared to previous 2 years ago.
again, this is deaths per million, so this is real numbers. And if I look to India with roughly 1 billion population, I don't see much down here. I'm not sure if this is true, right? If I go back, here is India, it's also quite low. I'm not sure, is this reliable?
Well, again, this is what's reported to the WHO, right? So
Yeah,
I think we can always scrutinize how they were reported, how the cases were being transmitted. Is it
yeah,
really correct? Are the data current or is it late? We don't know. This is just what is reported to the WHO.
yeah, interesting. Yeah. And here you have daily new confirmed cases and deaths per million people from the United States.
Yes, this is from the US and looking at the pandemic really since the beginning, right? You will see here that the peaks and deaths tend to occur after the peaks in cases, except for September 2021. And this is because during that time, there were really reduced counts in US cases and deaths because the states and territories were not reporting the information for some or all of the weekend. And so it's not because there were no cases or deaths, but it was because they were not reporting for some time. Maybe because it's the decrease in testing and testing requirements and policy. Maybe it's immunity from infection and vaccination. But you will see from March 2022, cases and deaths have really declined.
So you make a good point here. Cases we only find if somebody is doing a test, and deaths we only find if somebody writes a death certificate which says that COVID infection was present in the patient or not. So if you stop doing this, you won't find anything, right?
Yep.
And that has to do then with variants. And is there any information? I mean, right now in the United States, the situation looks quite favorable compared to the previous 2 years. So any information on the subtypes, on the variants that are causing morbidity and mortality?
On the next slide, actually, you will see that SARS-CoV-2 Omicron XBB.1.5 subvariant has nearly doubled in prevalence over the past week, and now it represents about 41% of new cases in the US. And this is according to the CDC data. And XBB.1.5 is highly immune evasive, and it appears to bind better to cells, our cells, than other members of the XBB Omicron subvariant family. And the rise of subvariants such as this one could result in a surge of breakthrough infections as well as reinfections, but we might not see them in the graphs because now testing is a bit different, right? As compared to last year, testing policies now are much different, and the reporting is also very different. So I'm not sure if we will see that peak necessarily.
Mm-hmm. So it's interesting how these variants emerge, how they some disappear. Here, this BA5 is basically gone. And then all of a sudden, not all of a sudden, quite rapidly, this XBB evolves here. This is quite interesting to see. And here you have where we are with the lineages, right? How the ancestry is from the original strain.
Yes. So we have shown a version of this in previous global health casts. And just to remind people that in many ways, viruses are like families, right? There's a complicated extended family tree with cousins, uncles, grandparents. And as with human families, you see that scientists can actually generate a family tree for viruses. And they are connected to parents by branches, and cousins are connected through their grandparents. But for viruses, these family trees give us insights into how a virus has evolved over time and what the changes are to expect in the future, if any.
Yeah. So we see how far we have gone from the original Wuhan strain.
It's quite far from the original Wuhan ancestral strain. Yeah.
Yeah. Very interesting. Yeah. But it gets more complicated, I'm afraid, right?
Yes, I mean, that's what viruses do, right?
Yeah. Yeah, I guess, and this is not even all individual patients, right? This is just the main variants, and you could go more. Basically, whenever you're infected, you produce a little bit new variant, right?
Mhm.
It's not a major difference, but if you start testing, you probably, if you would test everybody, it would be incomprehensible. It would be impossible to do any mapping of this, right?
Mhm.
But this is where we are, right?
Yes,
XBB
this is where we
105
are.
here on the top.
Yeah, and if you look at this, this is very complicated, right? You see all these variants, subvariants, sub-subvariant, and if you look at all of these different subvariants reported to next strain, there are hundreds, actually, thousands of them, and they don't all become dominant. Some of them become dominant, like this XBB.1.5, and this is actually a subvariant of the BA.2 variant, and it emerged as a recombinant lineage between the second generation Omicron subvariants. And if you ask me why this is happening, we don't know. This is really what variants do, right? Viruses, as long as they continue to infect people, they continue to produce more copies of themselves, make mistakes, and then you have all these different variants.
Yeah, interesting. And here you have some single countries now where you are showing vaccine uptake.
Yes, so this is from Japan. Japan is a country with 83% of the population. That's pretty high compared to many countries. 82% have received 2 doses, 67% received a third dose, and 43.5% received a fourth dose of the vaccine. So it's actually quite high. But also bear in mind that Japan is a country with the biggest number of people over 65 years old. So around 29 to 30% of the population are actually 65 and above.
And I guess this is just to show that they have excellent immunity compared internationally, right?
Yeah.
Yeah. And where are we now with case numbers?
Yes. So in terms of cases, this is what you will see. The health ministry of Japan actually said last week that COVID-19 cases have spiked among arrivals from abroad. So Japanese people who visit other countries, right? And this is more so with Japanese people who visited China and tourists from China, where the disease is currently raging. So in Japan, the 7-day average is around 140,000 new cases every day. Um, and if you look at the latest one, so there's a little there's a peak, and then it's going down a bit, right? So cases have decreased as compared to 2 weeks ago, and this small drop is probably gonna disappear in the next few weeks if really the cases will continue to rise because of Japanese people coming back to Japan from other countries, including China.
Very interesting. So they have a high vaccine uptake on the one side. They have a largely elderly population, and they have now huge case numbers. And the surprising thing is they did not have much in 2020, 2021. And all of a sudden it starts in spring, March 31st,
Yep.
2022. They start having relevant number of cases. Is this true data? Is this real, or is this an artifact?
Well, Japan is really a country with a very good infrastructure, so I would assume that this is more or less correct.
Okay, so that means they had a strict lockdown and they had no connection to the outside world. Other
Yep.
than that, it would not have worked. Yeah.
Mhm.
And how about mortality here?
Well, in terms of deaths, it's increasing, but keep in mind that this is per million people. The 7-day average at the moment in Japan is around 300 deaths, 7-day average. and the uh, and if you look at that in perspective, right? Because we've mentioned in the previous slide that the cases are around 147,000 every day, deaths is around 300 every day. That's actually quite low. And Japan's population is over 125 million. And so for the pandemic, so far it has killed around 57,000 in Japan. So judging from an overall pandemic performance, I would say that Japan is still one of the countries that performed really well in this pandemic.
Yeah, looks like it. And look, 2.5 per million deaths is not really much if the population is above 100 million. So this is
125 million,
this
yeah.
is really good. Yeah, they were doing well. Yeah, very good. I agree. And how about the perspective on China now that they reopened the country and stopped all hygiene measures?
Yeah, so these are some of the headlines related to China. A lot of exaggeration, if you ask me, calling it thermonuclear bad, as you see here in one of the title of the headlines, right? But again, we do not really know the situation since China, as you have seen in the first few slides, they do not really share numbers of cases and deaths, so we can only speculate, and it doesn't really help that they're not sharing information, right?
Yeah. Actually, it hurts them because people worry and there are rumors and there is no data that you can make good evidence-based decisions. You cannot. And
Yep.
then that is bad for the country. Interesting. Yeah. So what do people do about it? And I think you summarized something here on this slide.
Yeah. So here on this slide, you will see the different measures adopted by different countries because of this news of rising cases again in China, right? And I guess what I wanted to ask you, Professor Schmidt, is what do you think about border closures? Do you think they are effective, or do you think these measures will be effective in stopping the spread of whatever it is that is coming out from China?
Yeah, the question is difficult and the answer is not easy. My view is within Europe. I mean, I have family just returning from Austria and from Italy, actually from Rome for a short trip. And if one of the countries in Europe is doing something and the rest does not follow, it has no impact, right? Several thousand people each day go to Rome and come back from Rome, or Spain, Madrid. I guess there are Frankfurt Airport, just 20 minutes from where I live. There are several planes each day, each of them carrying 200 people. And there are 5-10 flights a day. And so measures in one country won't have an impact. That may be different in Japan. If they close, they close. The United States, if you live in Kansas City, you won't be much exposed to returners from China. That may be different in New York, though. But if you have it nationwide, it may have an impact. And the same may be true from India. I don't know the situation there. So the answer is it depends on where you live and how, in the end, it's all about exposures, right? How exposures continue. And if Italy comes up with ordering testing for everybody returning from China, it won't be a long-lasting effect because people from France, Spain, Germany, wherever they don't do the testing at this point, they will fly into Italy anyway. So you will have a little delay and then see the consequences. I'm sorry for the long answer, but it's a difficult question.
I think it's really difficult to answer. And as we've mentioned many times in the Global Health Cast, there is really no one size fits all answer for COVID.
Yeah.
COVID closure
Yeah.
or restrictions, right? Because each country needs to decide, taking into consideration many factors such as COVID vaccination rate, hospital capacity, the pros and cons of closure, what exactly are they going to restrict or close, political considerations, economic considerations, and many, many others. So I think it's really something that a country should decide on for itself.
Yeah, and they should know that it may not have an impact as long as other countries don't follow, at least here in Europe.
Mm-hmm.
Melvin, I just have one study that I think is very interesting. There are two things that are interesting on this study using Molnupiravir, medication against COVID. And there are two items that are interesting. Number one, the study conduct, how they run the trial. And the second is the result. And the way they run the trial is it is a trial to look for the safety, effectiveness, and cost effectiveness of the drug in those who are at high risk for morbidity and mortality from COVID. So this is data that is lacking, and this is why they did the study in the United Kingdom. Again, it is national, multi-center, open label, not blinded, multi-group, prospective, platform adaptive, and it is randomized. So platform adaptive means it was conducted via internet. Participants were aged 50 years old. So this is the risk is age. The risk for COVID is age, or above 18 if you have a relevant comorbidity. Now, and that these, I mean, they were really looking for those who are about to suffer or to die from COVID. They had to have COVID for less than 5 days. Then they were randomly assigned to receive the drug twice daily for 5 days. And again, it was all run on the web, and the analysis was stratified by age, and again, also by comorbidities and by vaccination status. The outcomes were tracked via self-completed online daily diary cards for 28 days after randomization. Very nice. And the primary outcome was all-cause hospitalization or death within 20 days of randomization. This is the relevant outcome. Do you make it to the hospital or do you die? This is what is basically left these days if we talk about COVID disease in subjects, in humans. And again, the nice thing is really that this is all web-based, and this is something that we will read in the future much more often. And this is the one item that I wanted to show you. This is innovative. Now, the results are they had 26,000 participants. I mean, this is a major trial. I worked for Pfizer, and the largest trial we ever did was roughly 85,000 subjects. And that was not internet run, but it was really physical follow-up. And I can tell you, this is a nightmare, right? The logistics is unbelievable. And here they had 26,000. And as they did it on the internet, the logistics was manageable. The mean age was 56 years. So they were not really the old people. They were the younger of the older ones, right? 56 is not really old. And 94% had at least 3 doses of the vaccine. Hospitalizations or deaths were 105 or 1% of in the participant group, and it was about 1% in the usual care group who did not take the medication. So there was no difference, right? You don't need the statistics to see it doesn't matter. The adjusted odds ratio, and now this is the math behind it, was 1.06, and this is the probability or credible interval. So it is crossing the 1, so it is not significant. The interpretation is that the drug did not reduce the frequency of COVID-19 associated hospitalization or death among high-risk vaccinated adults. To make a long story short, they did include those who had a high risk of making it to the hospital or dying, but the inclusion criteria were not strict enough to really concentrate on those who are very old or who have a high likelihood of dying. The message from the other point of view is COVID is not really a big danger for your life anymore, even if you are older person or if you have some comorbidity. This is one of the good news. And then a drug cannot do much if your risk of dying is really very low to begin with. And this was also said, and I skipped this a little bit in a commentary from Australia, and they embark on the study didn't really identify those who are at high risk of dying. And I guess they would have needed much more people in the trial to find a difference in the treatment group. But you can also turn it around and say you only have to include those who are above 75 years with comorbidities. They have the highest risk of making it to the hospital and dying. And basically, I just wanted to highlight that Molnupiravir is not licensed in Europe, but apparently it is available, along with Paxlovid, another drug that is used to treat COVID. And again, it is only recommended for those who are at high risk of getting severe COVID and making it to the hospital, or who even would die from COVID. Melvin, any views from your side on the study or on COVID and COVID treatment?
No, I think just to emphasize what you've already mentioned, that at the moment, COVID is not as deadly as it was 2.5 years ago. We are in a different situation at the moment, and even the older adults now really are not as high risk in terms of dying from COVID, and that is that is the good news, I would say. But I think we should focus as well still on the really high risk, 75 and above, those with comorbidities and chronic medical conditions, and really make sure that these are the people that receive treatments, antivirals, and booster doses if needed.
Yeah. So, but in the end, over here in Germany, what was said officially by KOLs in the country is the pandemic is over. So my question to you, Melvin, is the COVID pandemic over?
Well, the definition of pandemic is really still not very clear for most people, right? And I think we cannot declare the pandemic over because it's still still killing many people every day. There is an outbreak happening in China and elsewhere. But maybe countries can say that the acute phase of the pandemic is over in a specific country. I think they can say that if that is really the case.
Yeah. So what I wrote down here is there is a first no, because individual countries like China, and you showed that nicely, also Japan, they have ongoing morbidity and mortality, even if mortality is lower now with the new variant. So the answer is no in individual countries. It is also no if the answer is looking at the epidemiological point of view. What we see is reduced severity, but there's still high morbidity and mortality impacting medical systems. We still have a problem with hospitalization, with medical staff that is ill and doesn't show up for work. So the only thing you can say is it is over with regard to severity. That is reduced with a new variant. And I think it boils down to the question, what does endemic and pandemic mean? And here my answer is, the definition that was used here in Germany is that the high number of severe cases is reduced, and we will have now a continuous, indefinite microbial circulation in our country. And I think, but this is not the real epidemiological definition of endemic, right? Endemic means it is here. But the epidemiological definition would be, what is the basic reproductive rate? And it is still above 1. We still see a high number of cases, and one person is infecting more than one other person. So we still do not have an endemic which would mean R equals 1, but we have R above 1, and that's the definition of epidemic or pandemic if it is globally. So globally, we still have a pandemic. And finally, outbreaks will occur in the future with waning immunity. They may come annually. There may be new variants like with influenza every year. So I'm not sure. The pandemic is by far not over. And the way the word endemic is used over here in Germany is simply not the epidemiological definition of epidemic.
Yeah, so I think the confusion here is because people think that pandemic's opposite is endemic. Like endemic is the opposite of pandemic, but these two are related, but they're not opposite of each other, right? You can have an endemic disease where the cases are there happening, you expect them to happen, and sometimes you will have epidemics happening, for example, like influenza. And yeah, so this is just a confusion in terms of definition, because people think that the opposite of pandemic is endemic.
Yeah, it is not, right? It has
It's not.
pandemic just means there is an epidemic globally,
Yep.
and yeah, or of global concern with WHO definition. Lessons learned, looking back to 2022 and before 2020, and this is our lessons learned from today, and we may have more in the future. And my first lesson would be communication is crucial. We need to communicate correctly the potential benefits of vaccines. And people in Germany anticipated, if I get vaccinated, I will never come down with COVID. And that perception that was fueled by the media is totally wrong. It does not apply to a single vaccine that is out there for respiratory tract infections. Influenza has an efficacy, the vaccine has an efficacy of roughly 50%. Bordetella pertussis has a higher efficacy, but it doesn't stop the circulation of the organism. We cannot eradicate Bordetella pertussis. The pneumococcus has an animal reservoir. It will be never eliminated from the globe. So I think the first wrongdoing here by the media and by KOLs as well, I guess, is they did not communicate that vaccines will not once and forever eliminate the organism. Any comment on that one?
Just to say, Professor, that maybe some of our audience do not know what KOL mean. It's
I'm
key
sorry.
opinion leaders. So
yeah,
just to say that.
yeah. Yeah. Okay. I have more lessons learned. The number one is scientific language matters. I remember when COVID came up, our first public television, the news speaker again and again spoke about about the anti-COVID serum. And she meant a vaccine. And actually, she didn't mean a vaccine, but a vaccine candidate. And she mixed up all the terms all the time, again and again for months before, I guess, someone told her that her language was incorrect. But I think it is important to use the right terms so that there is no confusion about what will happen and what may happen. And I think, Melvin, you may have more thoughts on language and science and communication.
Yeah, so I think some of the mistakes, actually many of the mistakes that happened in the past 2 years were related to communication and to messaging, because messaging has to be tailored, not too scientific, but not too simple as well. But it depends on who you talk to, right? And the one thing that we also forgot in the first few months of the pandemic, most scientists were talking in a very scientific way without being empathic, without putting some form of vulnerability. And the reason why I'm saying that is that, we were in the situation where we didn't know what was going to happen, right? So everyone was scared or just concerned or just really anxious about the future. And scientists and many government officials were not able to convey the message in a way with some form of empathy. And I think in the future, this has to change if we really want to do better for the next pandemic.
Yeah. And I guess misinformation is one of your favorite topics as well, with all the fake news out there in the social media. And maybe, I just wrote down misinformation results in morbidity and mortality, right? People don't get vaccinated. They do the wrong things. I don't want to go as far as saying they were swallowing bleach or went to the sun or, they did whatever was recommended, which was totally stupid. But any views or any additional comments on misinformation?
Well, it's really a fact that vaccination saved lots of lives. There is a publication saying that in the first year of the pandemic, vaccines saved 20 million lives at least. This is just the first year, right? And it's continuing to do that. But if you look at social media, whether it's Twitter, Facebook, LinkedIn, name it, you still see people sharing and sending all these information about how COVID vaccines kill people and all these things. And really, this is the problem, because people can just continue to believe what they want to believe in, even with really all these hard facts and results from studies showing otherwise. And I don't know what we can do about that.
Yeah. Look, we are free countries and everybody can say what they want and express their whatever type distorted views, but you only can address it by telling, look, this is wrong, and then come up with the correct information. I
Exactly.
guess we'll keep posted on that. And I think the one question that I have not on the slide here is, I think for a future pandemic, what would be needed is a vaccine plus exposure. And this is what people do not see. The exposure is needed once the variant is causing mild disease and you don't die from the disease. Then exposure is helpful because you can avoid it anyway at some point, right? And this is something that was not well communicated from the beginning. And but I guess we need to rethink the pandemic and strategies for organisms that may come in the future. Yeah. And we may cover this again in one of our next global health casts. Any other final discussion point here?
Well, I think we will have more of the lessons as we go along, because we will definitely learn more lessons as we go along. But I guess one thing that I want to emphasize to people is that it's not a question of if, because it will really happen in the future. There will be new pathogens that can potentially become pandemics, and we just have to be ready for the next one.
Yeah, very good. This was our first global health cast, and what we talked about is the COVID-19 update. Melvin showed you the XBB 1.5 variant and the phylogenetic tree. We looked into Japan and China. We talked about medication for against COVID, actually, and we just discussed main points, reviewed of COVID ever since 2020, what happened there and what we may be able to do better. This is our, I guess, your New Year resolution, Melvin.
Yeah, so just to remind people that sometimes actually less is more. We don't have to create New Year's resolution. We just need to do what's already working. We need to simplify, declutter, and just stop doing things that waste our time.
Thank you very much. That was a great end of our meeting. This was our first Global Healthcast in 2023. Thank you for listening to us. You will find all the slides in our show notes. Melvin, Happy New Year again, and you have the last word.
Happy New Year, everyone. Stay safe. Pandemic is not over.